is Dr. Ellie Miller, and this is my colleague, Dr. Amy Williams.
I'm John Lemon.
So after looking at your symptoms and the results of your test, we have decided to diagnose you with Huntington's disease.
Huntington's disease is a disorder that causes the nerve cells in your brain and body to slowly degenerate over time. This causes you to slowly lose your ability to walk and speak.
This is where your symptoms came from. You reported a tremor and some involuntary jerks. This is called a chorea, and it is one of the physical symptoms of Huntington's.
You also reported difficulty concentrating, which is also a symptom of Huntington's.
Yeah, I remember my mom had similar symptoms when she was diagnosed. Is it possible I inherited it from her?
We made a pedigree based on your family history. Huntington's disease follows an autosomal dominant pattern, which means you only need one copy of a gene to get this disorder. Everyone colored in has Huntington's.
Because your mom had Huntington's, you received one allele from her, and since you said your dad has no family history of the disorder, you received a normal allele from him. This means you are heterozygous for Huntington's disease. That's what this big A, little a means.
I'm married and we're thinking about having kids. What is the risk of them inheriting it from me?
Does your wife have a family history of Huntington's?
I don't think so.
Then any kids you have will have a 50% chance of getting Huntington's, as you see in the Punnett square that crosses you and your wife. Because your wife has no family history of Huntington's, she's a homozygous recessive and has no allele to pass down to your kids.
What are my options for treatment? I know that Huntington's doesn't have a cure, but is there anything I can do to try and control it?
Well, we both think that we should start by prescribing you with a medication called tetrabenazine. This will lessen your symptoms of chorea.
However, it is shown to worsen depression, so in your next point we will evaluate your status to show if you need an antidepressant.
It's really important that we address any signs of depression as soon as we can because many Huntington's patients suffer from depression and are at a higher risk of suicide.
My grandma both had Huntington's and they were both diagnosed with depression. What should I do if my symptoms get worse?
Now this is where we disagree. I believe that you should continue your medication to help with the symptoms, and later on when you get older, go to speech and physical therapy.
I want to present you with a different option. There's a new gene silencing treatment currently going through clinical trials, and it works to reduce the amount of Huntington protein that your body is making that is causing your symptoms.
So it's like treating Huntington's at the source.
Exactly.
Now I think this new treatment is too experimental, and gene therapy can be risky and expensive.
Yeah, I think I want to go with the safe route. This new treatment sounds a little too invasive, and if it's still in clinical trials, then it hasn't been researched enough. I think I'll just stick with my medication and do some physical and speech therapy later.
Great. If we treat the symptoms as quickly as we can, it is possible for you to enjoy a long life.